Hello friends, I'm your host Bharti. Many of us keep looking for various information to keep ourselves updated. And today Piramal Healthcare, following its core values of knowledge, action and care, joins hands with the medical fraternity to bring you a unique show, Help Your Body. With this you experience a gamut of information in the area of cardiovascular ailments, which will help you understand the latest treatments and technology. And today it gives me great pleasure to introduce you to Dr.M.S.Karthik. Dr. Karthik is physician, cardiologist, diabetologist. His interests include music therapy to treat patients with cardiovascular ailments. Let's welcome him. Doctor, welcome to our show.
Hello.
Diabetes is a complicated condition and needs to be managed comprehensively. Diet control, mental health, heart and kidney problems should be considered while managing diabetes. Today we will discuss diabetes management in general. Doctor, is there any impact of diabetes on mental health or vice versa?
Yes, diabetes doubles the risk of depression. Why diabetic patients develop depression? There are two reasons for it. One is their restricted lifestyle. Two is the fear of complications. Now, it is very important that we counsel our patients for diabetes. Once patients come to know that they have diabetes, they become depressed. So, we have to tell them that you can be normal and you can lead a normal life provided you keep your diabetes, hypertension, cholesterol under control. You quit smoking. More importantly, you have to follow strictly your doctor's advice. Now, apart from depression, diabetic patients are also known to develop dementia. Now, a lot of studies have been done which proves that even sleep disturbances can have an adverse impact on diabetes.
Doctor, can diet supplements control diabetes?
No, there are a lot of diet supplements which are available in the market. A lot of advertisements are being done for it. But trials have not been done large to prove the safety of the product. Therefore, it is very important that you discuss the diet with your doctor and your dietitian. When you want to go for a food supplement, always consult your doctor.
Doctor, are there any increased chances of infections in the patients with diabetes?
Yes, the chance of infection is more in diabetics due to two reasons. One, their increased blood sugar level makes the organisms thrive in the blood. Second, their immune system is not that good as in the normal people. So diabetics are more prone for many infections, which include skin infections in men and urinary tract infection in women. And during epidemics of influenza, the incidence of mortality is very high among diabetic patients. So most of the diabetic patients during flu epidemics should undergo vaccination, and they should also receive pneumococcal vaccination. More important, another infection is diabetic foot. So foot care is very important in diabetes, and many patients, if they don't treat properly, they end up in amputation.
Diabetic patients are prone to infection, so care needs to be taken care as to avoid infection. Doctor, apart from its micro and macrovascular complications, is diabetes associated with other complications too?
The micro and macrovascular complications are very deadly in diabetic patients. Apart from that, there are few other problems which the diabetics can face. One is fractures, which is more common among type 1 diabetics, which comes usually from childhood. Even type 2 diabetics can develop fractures. Dental infections are very common in diabetic patients, and therefore diabetic patients should visit their dentist at least twice a year. Apart from that, it has been found that diabetic patients develop colon cancer, and uterine cancer among women is also very high.
And doctor, what are the general guidelines for managing this disease?
Now, as I told earlier, diabetes is a chronic disease and you will have to live with the disease. And one has to definitely understand the pathophysiology in diabetes. So, in the general management, what we generally tell is diet. Second, exercise. Third, maintaining your body weight. And fourth, then only comes drugs. In that, mental health is also very important. Now, it has been found that due to a stressful lifestyle, most of the patients have difficulty in getting their blood sugars under control. So when we come for diet, it is always better you discuss the diet plan with your doctor and your dietitian, and you have to strictly follow the diet advice given to you. Next, exercise. This should also be planned with your doctor's consultation. 30 minutes walk every day, 5 days a week would be ideal. Next, you can manage stress in many ways, and listening to music will have a definite impact in your treatment. Fourth, you have to take drugs regularly and you have to visit your doctor regularly. You have to remember ABCDEF in the treatment of diabetes. A for A1C control, A1C monitoring, which tells you a blood sugar control in the last 3 months. B for blood sugar monitoring. C to keep your cholesterol levels under control. D is for drugs. E is exercise, and F is food.
Doctor, can music therapy be used for diabetic patients, and also can you share the results with us?
Yes, I would like to say that this concept of music therapy is 50 years old in the West, and it's slowly gaining popularity in India. It can be a very good add-on therapy to your conventional treatment. It is useful in a variety of conditions, and diabetes is one among them. Now, stress, as I told earlier, most of the time takes your blood sugar out of control. It is due to two important chemicals or hormones which increase the blood sugar level in the body. So, by calming down the mind, you can definitely bring your blood sugars under control. So, along with your treatment, if you listen to good music, you can have the following benefits. There will be a reduction in your fasting blood sugar, in your postprandial blood sugar, even HbA1c, and there will be a good BP reduction also.
Doctor, thank you so much for such valuable information. But before we sign off, do you have any tips for our viewers?
Yes, definitely. And in our general practice, we find that even though diabetes is a common problem, still patients are not fully educated about the disease. So once you understand the disease very well, the treatment becomes very simple. The first question I asked was about depression. If you have a full knowledge about the disease and you comply to your treatment well with your doctors, you can lead a normal and healthy life.
Doctor, thanks once again, and I'm sure that our viewers will stick to your advice. Thank you so much.
Thank you.
Viewers, I hope you found this episode insightful and helpful. But if you still have any queries, you can write to us at
Pranav Clinic, 173 South Market Street, Madurai. Phone number is 09345215266.
Viewers, keep watching Help Your Body, which will help you to help your body. हमारी कामना आपका आनंदमय जीवन. Take care.